Hello, this is Dr. Do again. This video is on alphabetic list of problems, still on letter H. Today I'm going to talk about one of the disease. I'll try to explain. It's very severe, could be life-threatening. There's no way it can be managed at home with a variety of causes, which is called hydrocephalus. What is hydrocephalus? What are the causes? Why I said it's life-threatening? There's no way it can be managed at home. Basically, hydrocephalus is a presentation. It's a cluster of causes, a cluster of diseases, but present as the swelling of the brain. So when I explain this, you probably already get the idea why I emphasize at the beginning of this video is life-threatening, emergency. There's no way you can manage at home because it's a swelling of the brain. The consequence of the swelling of the brain is this. You can imagine, you probably know it. The brain and encephalus, it's enclosed in the skull. So there's a limited space. There's some subtle space, the ventricles and also the interstitial space, but it's very limited. So if there's any occupant or inflammation of swelling to cause this increase the volume of the inside of the skull will cause this severe symptoms or consequences. From minor, just headache, it could happen, until the severe loss of consciousness and even impaired the life center, which is oblongata. So that's where the respiratory cardiac center is located. So this is about why I emphasize it's severe. I try to explain because this usually not happened. If it happened, it's really severe. The physicians and all the teams will be alerted, and also it's very have to be fully attended to treat this kind of condition. So having talked about that, teasing off the consequence and the explanation, then what are the causes? Like I said, any causes like from occupant, either the hematoma or the tumor, malignant or benign, or big enough to occupy the space, so that can cause the increase of the pressure and associated with the edema around the tissue and causing this loss of consciousness, coma, or even serious consequences. Or the infection, either viral, bacteria, either meninges or the encephalitis, meningitis or encephalitis, all can cause this edema inside of the skull, the brain tissue. Or there's some vascular disease, older people, stroke. Even though you think about the ischemic stroke, no bleeding, however, this ischemic stroke can cause tissue damage. In short time, probably cannot see the encephalitis or encephalus, or with time, the damaged tissue will undergoing the inflammation change, necrotic, and can also cause this secondary increase the pressure of the brain. So what are the signs? What are the symptoms? I haven't talked about the causes. I just summary. There's some other causes. The symptoms, it's very severe, from minor, like I said, but usually it's severe, loss of consciousness, loss of the neurological function, and the treatment is very, I think it's very critical. Sometimes you use antibiotics, sometimes you use the steroid, and sometimes you use the other measure to dissolve the thrombi or to stop the hemorrhage. And there's a particular medication, mannitol. I think it's also very critical. What mannitol do is mannitol infused to the blood vessel, increase the oncotic pressure, which driving the fluid, around the tissue to the blood, circulate, and then through the kidney and excrete from the body. So this mannitol is very critical to manage these conditions, loss coma, hydrocephalus. So that's the one of the important medication. Along with this mannitol, there is a cautious also if the pressure in the inside of the skull in the brain lowered too fast. That's why I said this is very delicate. Has to be very experienced physician to. Of course, there's a protocols to follow. If the pressure is lowering too fast, then can cause the hernia, which means the brain tissue is protrude out from the foramen magnum. So this from the back of the skull. That's even worse. So this is the condition. I'm kind of I was hesitated whether I should talk about it or not talk about it. But I just bring here to give you some idea what kind of consequences either for stroke or encephalitis or meningitis, if not treated in time fashion, if not managed properly, this is probably the consequence, the end stage. Very serious complications, and eventually, like I said, if the center of the life, medulla oblongata, so if that's impaired, the respiratory center, cardiovascular center, that's where it's located. So if that's the end stage, if not managed properly in time fashion, emergently, so that's the consequence. I do not know whether usually this kind of condition occurred in the hospital settings, or could be in some at home if there is severe vast amount of the blood bleeding, hemorrhage can also cause this, or severe encephalitis or some or severe injury can also cause this. So that's why I bring this video here. I hope that just give you some idea if this occurred around you or around your family. You know it if the patient has past medical history, developing this sudden neurological deficit, and the sign for you to look at probably cannot have to be medical professionals to diagnose this. But what you can do as a family member, just call the 911 or call your physician as soon as possible to prevent this serious complication, serious end stage of the disease. So I hope this video can help you, but probably not covered enough, comprehensive, but just give you some idea. And thank you for watching. I will see you next time.